Hi everyone, I'm back today to talk about ADHD, attention deficit hypermobility disorder. And the information I give today will be applicable to adults with ADHD or also parents of any children who maybe have just been diagnosed with this disorder. I'll be talking about how massage can help relieve sort of some of the symptoms of ADHD, and in turn how it can therefore really improve, I guess, the quality of life really of those that have it. Now, ADHD is actually fast becoming probably one of the most common psychiatric labels out there. One of the primary causes of behavioural issues. It's also been linked with learning disabilities. Probably about 2/3 of children with ADHD also have some other kind of developmental disorder, maybe something like autism, bipolar, or some kind of learning disability. ADHD affects 3 to 7% of school-age children and adolescents, and 9 times as many boys are diagnosed with ADHD as girls. I'm not quite sure why that is, but so it's affecting quite a few kids out there. So and I think one of the main issues from parents of children with ADHD that I've known is that they don't seem to have a huge amount of information out there. It seems to be kind of pretty much a standard route of once you get diagnosed, which can in itself be quite difficult. Medication, basically, that's the answer. And there are other treatments that can work either alongside medication or potentially even instead of, obviously depending on sort of how bad the symptoms are. I'm certainly not saying do not, take the medication. I'm not saying that at all. It has its place, but we'll discuss that further through the course of this video. So first off, I am going to really just talk about what sort of symptoms does someone with ADHD experience. So probably the big one is difficulty in focusing their attention on anything for any period of time. Concentration really kind of goes out the window, which obviously for children at school can be quite challenging. And quite often they might just be, seen as a naughty child, when actually, there may be more to it than that. People with ADHD, they tend to have very impulsive behaviour. They don't really sort of think about what they're doing before they do it, and so they can have quite poor decision-making skills sometimes, and poor problem-solving abilities, and this can sort of extend into them having a poor academic performance in general. They are obviously very overactive. The levels of overactivity would be past what would be expected for their age group. This can then cause problems. They would have difficulty in social situations, and may sometimes, have trouble making friends because of this. They can't adapt quite as well emotionally as children that don't have ADHD. They can have speech problems. They, as we've said, it can be linked with learning disabilities and mood disorders, things such as bipolar, anxiety disorders. And there's just generally a higher risk of sort of delinquent behaviour, substance abuse, and various other addictive behaviours, sort of leading into adulthood, that I'm actually going to discuss a little later in this video. So yeah, there's quite a few symptoms, which obviously challenging enough for an adult. For a child, it can quite often get seen as that child being naughty, and I think quite often we're sort of falling into two ends of the scale with ADHD diagnosis. On the one hand, it seems to be very difficult to get some children diagnosed, say because they may just get seen as a misbehaving child. But on the other end of the scale, it almost seems like this easy label to put on any child that is, maybe a bit out of control. So that's probably why the whole diagnostic procedure sort of can take some time, which I think again is quite frustrating for parents. But so talking about the treatment, how do we deal with these symptoms when a diagnosis is made? Well, more than 5 million children are prescribed Ritalin for ADHD. That's the standard medication. It can improve the attention span of the child, improve their concentration and their focus, which obviously is going to help them certainly in school and with their academic progression, but also, in everyday life as well. And it can improve general behavioural symptoms, usually in about 75% of cases. So this again would certainly help with those social difficulties and making friends, which obviously can also affect, a child or an adult's self-esteem. But the issue is that the effects actually only last as long as the medication is taken. So obviously there has to be a certain level of compliance there. As with any medication, we're going to see side effects. They don't occur in everyone who takes Ritalin, but they certainly are side effects, experienced by many. These can include things like nervousness, headaches, trouble sleeping, rapid heart rate, sort of agitation, and almost overexcitement, which is kind of what you're trying to avoid. Hallucinations can be one, high blood pressure, seizures, and sort of in more severe cases, it could even extend to psychosis. So quite a few, pretty substantial side effects there. And so you can understand why some parents may be reluctant to have their child prescribed Ritalin for the management of their disorder. So we're going to look at how massage can help those with ADHD, children or adults. It's not necessarily a replacement for the medication. It may be something that will work alongside the medication, or possibly, something that means you may be able to just sort of reduce the dose of the medication. But obviously I would never advise doing that without medical advice. But we're going to talk about massage and how it helps with some of these issues that people with ADHD are facing. So in general with children, we usually say that shorter and more regular massages are more effective. And certainly, they probably wouldn't sit through a full sort of hour-long massage. So we would suggest a 20-minute massage, maybe twice a week. And this can really significantly, improve those symptoms. This can be done either, if we're talking about children with ADHD, this can be done by a therapist such as myself, or, certainly I even teach parents how they are able to give their child a massage, which, can also improve things like, parent-child bonding, which sometimes, can be difficult when you have a hyperactive child. So we're going to look at how massage can improve this disorder. So massage can improve concentration and therefore a child's ability to do schoolwork. As we've already, as you'll know from some of my previous videos on the benefits of massage, improved circulation to the head, easing stress levels and just relaxing all the muscles, that can really help improve someone's concentration and focus on even daily activities. It can also help reduce fidgeting, again through relaxing those muscles and just sort of calming the mind, calming down the immune system and nervous system. It really can help all that sort of agitation. Improved mood. We know that massage can reduce the release of those stress hormones such as cortisol, and obviously it also promotes the feel-good endorphins, things like your serotonin and your dopamine, which really help lift depression as well. So it's going to improve the mood. It will generally help improve long-term behaviour, improved alertness in school, and just generally increasing a child's confidence, and just general sort of improved academic performance as well. It will also help encourage the child to be a lot just generally calmer, which in turn will help with their social interaction with others. It can really help calm children down before going to bed, which is quite often an issue for parents. And it can also just, when a child is much calmer, and even adults, if you're feeling much calmer, if you're feeling less stressed and you're just generally more relaxed, it helps you then, make decisions more easily. It helps you, solve problems. It helps you develop your coping strategy, for when something stressful does happen. So, quite a few benefits there of massage. And when you look at all those sort of characteristics of someone with ADHD, the, inattention, the hyperactivity, the impulsive behaviour, maybe short-tempered, having difficulty in following directions, remembering information, concentrating on tasks, organising their workload, you can see why massage will help, calm this all down, and basically allow, the child or adult, to kind of live a fuller life, really. I've also talked in my video about psychological and emotional benefits of massage. I've talked about how massage can help with anger problems as well. And quite often it's a common thing that probably children in particular with attention deficit, they can be quite defiant in their behaviour. And so this again is something that can really be helped through massage, just helping to sort of calm the mind and control that sort of slightly more erratic behaviour. And through managing these problems, we're helping that child to really overcome the not only behavioural but the social and emotional and academic issues that they face, if they continue to kind of be very irritable and highly strung and, hyperactive. So it really can sort of change the quality of life. Now, we've also talked about how massage can reduce the stress levels by inhibiting release of that cortisol hormone, and also it can reduce depression, improve mood through release of those happy, feel-good endorphins, thus improving mental focus and concentration. So in doing this, this is one of the many reasons why massage can be seen as potentially an alternative to Ritalin medication, but certainly a sort of therapy that can be used alongside the medication, and will really just help improve the effectiveness of the medication. So I want to actually talk a little bit about how massage really becomes particularly beneficial in those with ADHD that are not medicated. We've talked about the benefits of massage in ADHD, improvements in impulsive behaviour, inhibiting the stress hormone, and research actually shows that those with ADHD that aren't on medication, their sort of form of self-medication can be with a lot of addictive behaviours. So it could be drinking, it could be drug use, it could be comfort eating, or it could be, sexual activities of some kind. And the theory is that these activities are a natural way for that person to sort of get a release of dopamine, which is one of those feel-good endorphins. And these activities are a way of kind of lifting that depression a little bit, boosting our, self-esteem for a little bit. And if you think of anyone without ADHD, we all have those sort of guilty pleasures that, we're having a down day, or let's have a cream cake, or, go out for a pint with the lads, and, it just kind of lifts us up a bit. So for ADHD, those are commonly seen behaviours, certainly going into adulthood, but there probably are signs sometimes in sort of childhood and adolescence that these behaviours may well develop. So it's actually thought from sort of various studies that ADHD may be due to the frontal lobe of the brain being underdeveloped. This hasn't completely been proven, but it's sort of strongly suggested through research. And when you think that the frontal lobe of the brain, it's absolutely loaded with these dopamine sensitive neurons, which are responsible for planning, problem solving, and also just limiting all the sensory information that comes through from the thalamus in the brain. So that's why sometimes ADHD patients are actually, very sort of hyperactive, because it's like they're being kind of overloaded with sensory information sometimes. But so going back to these pleasure-seeking activities that we've talked about, through participating in these, it's like a sort of a compensatory mechanism for the underdevelopment of the frontal lobe. It's a way for people with ADHD to compensate for that, reduced dopamine, the reduced amount of dopamine sensitive neurons that we've talked about. And so that's why there is seen to be such a high incidence of drug use, weight issues, promiscuity, cheating in adulthood, sexually transmitted infections. All of these things can actually be really quite common in those with ADHD that are not on medication. We'll just point out those that are on medication, are not as likely to participate in these addictive behaviours. So if we're looking at how, possibly in children, how they may start to show signs of certain behaviours in order to get their dopamine fix for the day. It could start from something simple like their favourite food, or habits that develop as a teenager. Obviously, when all your sort of peers and your teens, it's all about kind of who's going out with who. And so sex education in children with ADHD can be really important in order to overcome issues as they sort of transition into adulthood. Issues with hypersexuality, issues with contraception and prevention of sexually transmitted infections, avoiding teenage pregnancies, and just generally encouraging more positive decision making, which when you have ADHD, there's a tendency for low self-esteem. And so, people with low self-esteem, they quite often, they don't always make the best decisions. That's how massage can help. If uncontrolled, these impulsive behaviours, they're going to further damage your self-esteem. So, and this also, we've talked about difficulty in, social interaction. If you're participating in, if out binge drinking every night, or, taking drugs, that's certainly going to impact on how you relate to other people, how you form relationships, possibly could lead on to, other issues that mean, sort of even your sort of relations and close friends could be pushed away. And in terms of the hypersexuality, obviously, if it's sort of to the extent where we're looking at promiscuity and cheating on partners, it's going to be very hard to maintain a long-term relationship. So so that's how massage can help. As always, any questions, you can contact me through my Facebook or Instagram, and I will answer you as best as I can. But in terms of ADHD, that's all for now. So I will see you next time. Bye.